Take our lead, let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
Mutations in the gene that provides instructions for making E1-alpha, the PDHA1 gene, are the most common cause of pyruvate dehydrogenase deficiency, accounting for approximately 80% of cases. These mutations lead to a shortage of E1-alpha protein or result in an abnormal protein that cannot function properly.
Make your mark, take our lead.
A medication called dichloroacetate may help treat some people with PDC deficiency. Doctors may also recommend a diet that is high in fats and low in carbohydrates, ketogenic diet. This can help prevent lactic acidosis but typically does not stop neurological symptoms.
Let's help you make your mark.
Pyruvate dehydrogenase may be allosterically activated by fructose 1,6-bisphosphate and is inhibited by NADH and acetyl-CoA. Phosphorylation of PDH is mediated by a special regulatory enzyme, pyruvate dehydrogenase kinase. This enzyme is part of the PDH multi-enzyme complex.
Take our lead.
PC deficiency typo, infantile form, begins in infancy and symptoms include developmental delay, intellectual disability, mixed acid-base disturbance with mild to moderate elevations in lactic acid and ketone bodies in the blood, lactic acidosis, ketoacidosis, abdominal pain, vomiting, tiredness and muscle weakness.
Take our lead.
Pyruvate dehydrogenase complex, PDC, is a complex of 3 enzymes that converts pyruvate into acetyl-CoA by a process called pyruvate decarboxylation. Pyruvate decarboxylation is also known as the pyruvate dehydrogenase reaction, because it also involves the oxidation of pyruvate.
Take our lead.
Pyruvate dehydrogenase complex deficiency, PDCD, is a rare disorder of carbohydrate metabolism caused by a deficiency of one of the 3 enzymes in the pyruvate dehydrogenase complex, PDC. The age of onset and severity of disease depends on the activity level of the PDC enzymes.
Make your mark, take our lead.
An elevated lactate to pyruvate, L-cheeky smiley face ratio may indicate inherited disorders of the respiratory chain complex, tricarboxylic acid cycle disorders and pyruvate carboxylase deficiency. Respiratory chain defects usually result in L-cheeky smiley face ratios above 20.
Take our lead.
Pyruvate is an important chemical compound in biochemistry. It is the output of the metabolism of glucose known as glycolysis. One molecule of glucose breaks down into 2 molecules of pyruvate, which are then used to provide further energy, in one of 2 ways.
Let's help you make your mark.
PDC contains 3 catalytic enzymes, 2 regulatory enzymes, and a binding protein. It also requires the cofactors TPP, lipoic acid, and flavin adenine dinucleotide, FAD. The first enzyme of the PDC complex is pyruvate dehydrogenase, E1.
Make your mark, take our lead.
Pyruvate kinase deficiency is an inherited lack of the enzyme pyruvate kinase, which is used by red blood cells. Without this enzyme, red blood cells break down too easily, resulting in a low level of these cells, hemolytic anemia.
Thank you for watching. Please subscribe and hit the bell notification.